Hello. So welcome to our last topic, this finals, which is your temporomandibular joint, or also known as TMJ. So the TMJ is the articulation of the temporal bone and the mandible. And that articulation is incongruent. So there's the presence of the articular disc. The articular disc is biconcave, which means that the superior border and the inferior border are both concave. You have your upper joint, or also known as superior TMJ, which is located here, and you have your lower joint, or also known as your inferior TMJ. The superior TMJ acts like a gliding joint, or a plane joint, while the inferior TMJ acts as a hinge joint. So these are the motions available in the TMJ. You have your depression elevation, protraction retraction, and lateral deviation. First, let's talk about depression elevation, or simply mouth opening and closing. So remember guys that rotations happen on the inferior TMJ, both in opening and closing, while translation happens on the superior TMJ. So during opening, there is rotation of the TMJ, of the lower TMJ, and then there is anterior translation of the upper TMJ. While closing, there is rotation posteriorly of the inferior TMJ or lower TMJ and posterior translation of the upper TMJ. So here's the photo. Next is protraction retraction, or simply anterior translation and posterior translation. Take note that there is no rotation and it happens in your superior or upper TMJ. Next is your lateral deviation. So there is rotation on the ipsilateral side, and there is an anterior translation on the contralateral side. Next are the ligaments. So you have your temporomandibular ligament. So it has two parts, and all fibers limits lateral deviation. So the two parts are your outer oblique and your inner horizontal. Next is your stylomandibular ligament and your sphenomandibular ligament. Both ligaments limits protraction. So the normal mouth opening is approximately 40 to 50 millimeters, or on some books that is 35 to 50. And the functional mouth opening has an average of 25 millimeters. which means that the length or measurement during eating and talking is only 25 millimeters. So these are the open pack position, the closed pack position, and the capsular pattern of the TMJ. So the general function of the TMJ is mastication or chewing, talking, and yawning. So let's talk about the muscles. So we have your muscle of mastication, which is innervated by cranial nerve number 5, or also known as trigeminal nerve. So those are your temporalis, masseter, medial pterygoid, and lateral pterygoid. So your temporalis, masseter, and medial pterygoid is responsible for mouth closing. And among those three muscles, your masseter is the strongest. And by trivia, your masseter is the strongest muscle in our body. And for mouth opening, you have your lateral pterygoid. Your lateral pterygoid has two fibers. Your superior fiber, which holds the articular disc in place to prevent displacement, and your inferior fiber is responsible for mouth opening. And you have your mandibular deviators. So those are your medial pterygoid. Its action is contralateral deviation, and lateral pterygoid. Its action is ipsilateral deviation. So for example, if the patient deviates his jaw towards the right side, so there is contraction of the left medial pterygoid and right lateral pterygoid. So these are the secondary muscles. So first is your suprahyoid muscles. Its action is to assist in mouth opening. And these are the muscles and its innervation. Next are your infrahyoids. Its action is to stabilize the hyoid bone. So these are the muscles and its innervation.